and welcome back to the Aesthetics Health Hub. My name's Julia Ogilvie, and today I've got the lovely Karen and Paula with me to discuss something that we're asked quite a lot in clinic by patients is what happens to our dermal fillers once they've been injected into our faces.
That is the question,
I
isn't
know.
it? I mean, it is such a hot topic just now. There is so much about, this like return to being completely natural, and you know, I think the things that we were taught about dermal filler when we started injecting all those years ago are definitely not the reality of what we're
No,
seeing.
definitely not.
I do remember like the rep saying, your patient will metabolize this in 6 months and then they'll need more.
Aye,
Yeah, and that's just not
no.
the case,
No,
is
it's
it?
not the case at all.
It's not the case. So I think like filler is definitely lasting for way longer than we ever anticipated it would. But also different fillers behave and integrate very differently in the tissues
And in different areas
and
as
in
well.
different areas.
I also think it's
Absolutely.
important to think about when we're talking to patients about how long filler lasts, there's a difference between what they see, so the aesthetic outcome, and then actually how long it's present in the skin.
Yeah.
They're two very different
Completely.
things.
Yeah.
Absolutely.
No.
And so we do ultrasound in the clinic, and when patients come in, we will scan their face if they've had treatment before, and they'll say things like, I've had filler 5 years ago, there'll be nothing
It's not
there.
there.
It's nothing there. And you're like, no,
It
there's
is.
there's
Yeah.
definitely
It's
still
still there.
filler
Yeah.
in your face. And actually there's still quite a lot of it
Yeah.
as well. So the filler is definitely lasting way longer than we anticipated it would. And I think it is also behaving in ways that we maybe didn't realize that it would as well. So it moves in ways that we perhaps didn't think was possible. We were always taught, for example, if you inject down onto the bone, it'll stay there, and it absolutely doesn't, does it? So there's a few different things that you've got to consider. One of the things that we have paid an awful lot of attention to is about choosing the right product that integrates very naturally into the tissue. And it's why I'm actually interested in your experience, because obviously you use a lot of
Yeah,
stillage.
over the years, so I've been in business 16 years, so I've tried lots and lots of different fillers and now work with Vivacay. And I just find their fillers, they just give you a nice natural look. You get the longevity from it. We went across to France to see, how they're made in the factory, the rheology of them, and France is completely different from UK.
Yeah.
So their safety standards are so much stricter than ours. So that in itself, for me, was a big thing. And I think it's really, really, really important that you work with the filler company.
Yeah.
You get to know about the fillers.
Yeah.
You get to know, the correct placement of the filler,
Yeah.
which is probably for all fillers,
Yeah.
if you want movement,
Yeah.
natural movement of our face, placement has to be accurate.
Yeah.
And product choice for that particular
100%, yeah.
It
And
is
I think it's
incredible. So all dermal fillers are created from the same foundation, hyaluronic acid, but obviously there's so many different processes that hyaluronic acid goes through to become the dermal filler that's injected into your face. And that has a considerable impact on the way that it integrates in the body. And whilst we are, very measured about what we put in our faces and our patients' faces, what we are seeing, I think, more and more is patients who have tried to, get as much as they can for the lowest price possible.
Yeah.
And they have dermal filler in their face, which is not integrating into the tissues. It is not breaking down uniformly.
I think we've all had these patients that come to us
I think part of
especially
the
lip
problem,
fillers.
and part of the
And
problem with the cheaper fillers is, often they're imported from other
yeah,
countries. They don't have the scientific data. So we
definitely.
don't understand, Paul has mentioned there no dermal fillers are equal.
Yeah.
We know that the processes they go through in formulation, manufacture are very different. And when we don't understand that, it's difficult to predict how it will behave
Yeah.
in the skin,
Exactly.
immediately and in the longer term. So I think for all of us, product choice is incredibly important
Yeah.
when we're thinking about what happens over the course of time,
Yeah.
when that
Yeah,
filler is
yeah,
in situ.
yeah,
And it's
yeah.
relevant to complications as well, because obviously the way that a filler is cross-linked will affect how it responds to hyaluronidase,
Yeah.
the dissolving agent. So most dermal fillers in the UK are cross-linked with BDDE technology, apart from Nuvia, which uses polymer technology. But that BDDE technology, that cross-linking, is also what makes hyaluronic acid different from the immune system, and what causes delayed onset reactions, or it's theorized that that's what causes delayed onset reactions. So when you're considering a filler for patients who, for example, may have an autoimmune condition, you really want to pick a filler which has the lowest level of cross-linking
100%. Yeah.
possible. So we use Revan-S as well. We do use Stillage for some patients, but we do use Revan-S as well. And Revan-S, their hyaluronic acid particles are spherical, so it breaks down quite uniformly over time, and they have an extremely low level of long chain cross-linking as well. So they have sort of theorized that that will make it better for patients who are prone
And do you
to.
get the longevity out of them?
You do,
Mm.
yeah. I would say so. The thing about longevity is that it is that longevity that will make it visible to the immune system. So if you look at the filler that is notoriously bad for delayed onset nodules, which is the Juvederm Vicross range,
But
that
they'll
range,
deny that.
they will deny that. Yeah, of course.
Despite the evidence out there.
But you can see that in the MOD study, and whilst that's
Mm.
not a study that can, draw conclusions, there is evidence that is a filler that has more delayed onset nodule incidences. Whether it's causality or not, don't sue me. But the Vicross range was designed to be extremely long lasting, So I think filler might not necessarily be the best thing in the world if a filler has very, very long shelf life
So
in
it's
the body.
probably about educating our patients more
Yes.
as well. And to be fair, I agree with the longevity aspect, and it's not such a good thing. But people change as well. Do you
Yes.
know,
Absolutely.
bone recession,
Yeah.
muscle mass,
Absolutely.
fat pad atrophy, skin
Absolutely.
laxity,
And
hormones
throw
come
weight loss
into
into
that.
that now as well.
Oh,
Absolutely.
yeah, Monjaro. I
Yeah.
mean, people are walking about with skinny faces now, and if you had put fillers in their face 6 months before they lost all that weight,
Oh
it's going to
gosh,
look
yeah.
completely different.
Yeah. Absolutely.
Yeah.
So you do, when we are sort of thinking about a filler, we're not sort of saying to patient, I want a permanent implant in your face, although I do tell them it is a semi-permanent implant. Like, you say to them, it's going to last longer than your semi-permanent eyebrows. This is a semi-permanent implant in your body, but you want it to break down over time. So you don't want it to be there indefinitely. So for us, we do want to use a filler that when it breaks down predictably and uniformly, as opposed to, in some areas the breakdown is more rapid than in other
Yeah.
areas. And there is a lot of technology and a lot of science that goes into dermal fillers, and I think people often pick dermal fillers because it's what they were trained with, or because it's what is most cost effective for them. And ultimately it's just about saying, I couldn't look at your clinic and tell you what the right filler is for you. Only you can make that decision. but ultimately you have to look at it. You wouldn't start using a medication protocol in your clinical practice without being very, very clear about what the risks and benefits were of that
Definitely,
medication
yeah.
protocol. And dermal filler is no different, is it?
Yeah,
I
which
think one of the
patient is
things I
suitable for.
probably welcome when training becomes more standardized is that, like you said, Paula, on training, you're taught this is the filler that we're putting in cheeks, this is the filler that we're
Yeah.
putting in
Yeah.
lips.
This is the amount.
Yeah, and it is so much more complex
Yeah.
than that. It's not just about choosing the products based on where it's going and what it's going to look like at the time. It's so important that we understand, what happens over the course of time to that when it's in
Yeah.
the patient's face. And
Definitely.
and like you said as well, in the
Yeah.
event of complications, albeit they are rare,
Yeah.
that we have some predictable data
Yeah.
about how that filler will
Yeah.
respond.
And I think now as well, we're becoming more aware of the quality of skin before we even put a
Absolutely.
needle
Yeah.
anywhere near it. So
Mhm.
it's about preparing that skin before you do that
Yeah.
injection. And I think patients are becoming more aware of that themselves
Yeah.
and they're happy,
Mhm.
when you sit and explain that process.
Yeah.
It's,
And I
definitely.
think it's about using the right technology as well. I think the term
Mhm.
filler puts a lot of people off. And actually, like hyaluronic acid, it is a biostimulator.
Mhm.
It's quite like
Mhm.
it does stimulate collagen production. So, if you were to say to somebody, would you like regenerative treatment or would you like dermal filler? They would say regenerative treatment,
Definitely
Yeah.
wouldn't
now,
they?
yeah,
So I think it's
definitely,
about
yeah.
using your words
Mhm.
cautiously. Like we're not aiming to fill faces
No,
anymore.
Mhm.
We're
no,
just
no.
we are aiming
Yeah.
to practice regeneratively. Um, but I think you're absolutely right about training. And one of the things that kind of irks me in the aesthetic industry is this assumption that if a patient comes to you and their face is migrated, that it is the fault of the practitioner that has treated them. And ultimately, I think all aesthetic injectables will migrate at some point. They absolutely will. There are so few closed compartments in the face, and the face is such a highly mobile
Yeah.
organ
Yeah.
that it is almost impossible to
Mhm.
predict where dermal filler will stay when you've placed it. And a good example of that is that when you inject in the piriform or the lateral cheek, for example, we are seeing very, very commonly patterns of migration up here
Mhm.
and into
Mhm.
the temple. And there's some emerging evidence. I want to say it was Leonie Shelkey who was looking at ultrasound, and she noticed that different patients have different patterns in their reticular cutis. So that's the connective layer between the papillary dermis and the fat. And what we thought was that that was a sort of closed fibrous network and dermal filler wouldn't be able to slip through that. But actually, depending on the patient, some patients are highly, highly susceptible to mobility of dermal filler through that reticular cutis. So it's really about being open to the fact that we cannot predict
No,
anatomy. We can't see
absolutely
under the
not. No,
skin. And with the
definitely.
best intentions of the world, with the best
Mhm.
surgeons doing the best procedures, ultimately we are working with an
Yeah.
area that is
Yeah.
so highly mobile with very, very few fixed points, and dermal filler
Yeah.
will move.
And especially if someone's been unwell. I remember years and years ago, about 10 years ago, having radiesse
Mm-hmm.
in my cheeks, and I took the flu. Oh my God. I had big lumps here, I had big lumps
Stop.
here. Honestly, it was just horrendous.
Mhm.
Yeah.
And then pregnancy as well. You
Yes.
get a
Yeah.
lot of women because of the circulating volume being higher,
Mhm. Changing hormone
exactly,
levels. Yeah.
more
Yeah.
estrogen, then you get the filler swelling up as
Yeah.
well. So
Mhm.
if it's going to swell, it's going to move.
Absolutely.
So yeah,
Absolutely.
definitely. There's lots of
And I think it's just about being open with patients as well. And so when we treat them now, it's a very different conversation that we
yeah.
have with them. So for us, we are using dermal filler completely differently to how we did 10 years
Yeah.
ago.
We're not just filling lines and
Absolutely not. So
no.
we've got this deeper understanding of what facial aging is, and, you know, even some of the terms that we've used about ligament laxity and things like that, like your ligaments don't stretch. They don't stretch when you get older. Yes, they're not as elastic, but it's more about bone reabsorption and fat pad atrophy and all these sorts of things. So if we can, if we can create better anchor points for the ligaments, and if we can place dermal filler strategically rather than aiming for this just, fill in lines and wrinkles, you get such a better aesthetic outcome.
It's about support, isn't
Yes,
it? Definitely.
absolutely.
Structural support.
Structural support over
Yeah.
over big
100%.
volumization.
And I think
No,
if you
definitely.
address the structural changes first, you actually find that less volume is needed. So
for
I think
sure.
it's important that we do that first and then reassess before we look to
100%, yeah.
volumize to give
No,
those patients
definitely.
the most natural result, and hopefully a result that's going to
Yeah.
look
Yeah.
good for a
Absolutely.
period of time, because I think that's important as well. It's not just about how it looks on the day, it's we want that to look good as
Natural.
time
The
passes.
best outcome of your work is not how your patient looks in their before and afters. It's how your patient looks 2 years when they come back to you.
Absolutely.
100%.
Mm-hmm.
And I think, even taking it back to basics. So, one of the first areas that you were ever taught to inject was the nasolabials. Now, for me, I don't fill nasolabials. I just don't
Haven't done
fill
for
them.
years.
No, because when a patient sees their nasolabial, although that's where their line is drawn to, that's not where the problem is. And it is about encouraging education of patients to say, don't go to your practitioner and don't book in for nasolabial filler. Don't do that. Book in
The
for
issue
consultation.
also lies that, if you say to someone, we need to start in your temporals, we need to pull back preauricular, they kind of look at you as if to say, but it's here that's, do you know, and how is that going to, and so your consultation needs to be quite extensive, doesn't it?
Yeah.
Really.
Because you're right, they come in with the concern of where their eye is drawn.
Exactly.
And like you said, that's not the cause of that problem. So it's really important that we're assessing full faces and not just like, oh, you've got a line there, yes, I'll fill that.
Yeah.
We need to approach it very differently.
Yeah, and ultimately what you see is, so you put filler in there, it looks great on the day, and then 6 months later they come back in and their nasolabial is deeper than it ever was because it has moved out of the fold.
That's right.
Because there's so much muscular activity in that area, and the problem is now worse than it ever was. And we often get patients that have come to us and they've been to a practitioner who has, with the best will in the world, done what they've been trained to do, but the outcome is now that their nasolabial fold is worse than it was. And it's about sort of then saying, look, you've actually got filler in your actual nasolabial fold, and it's not what it should be. We need to dissolve that, and then we need to actually address the root of the problem,
And quite often that patient will think the answer to that is to actually add
put
more filler.
Yeah, that's
So
right.
I think we have, like you said, your consultations are so different, Julia, because taking the time to explain why that is the right thing to do and how we address that correctly, that takes time, and for the patient to digest that and trust that
that's right.
your suggested course of action is the correct thing to do to give them the result that they want. And it might take a little bit longer to get there.
Absolutely.
Yeah.
Absolutely.
And all they have in their head is they've maybe seen a before and after picture somewhere.
Yes.
And we all know before and after pictures depends
They're
on
meaningless.
so many
So many things.
So many things, do you know?
Absolutely.
Lighting, position, whatever. And they can be doctored to make them,
Absolutely.
them look amazing.
And ultimately, these lines are normal.
Exactly,
My 13-year-old has these lines.
Exactly. And that's why I always say to patients, I'm not here to make you look 20 years younger.
Yeah.
Not at all. I'm here to make you look good for your age and fresher and more rested. Not, I'm never going to take away all, and I'm very brutal about that. Never going to take away all those lines. most of my ladies are 40 upwards, so, I just explain you're supposed to have lines. We can
Absolutely.
soften them, but we're never going to
Yeah.
eradicate them. And if I did, it would make you look plastic anyway.
It would look
So you don't
unnatural.
want that.
And I know
Yeah.
you spoke recently with Jill about patients are presenting older,
Yeah.
and I think
That's
it's
right.
about being realistic and
Mhm.
age appropriate changes.
100%. Yeah.
We
100%.
don't want to make people look unnatural or alien or odd. It's about, like you say, making them look refreshed, making them feel better about their
Mhm.
appearance,
Yeah.
but doing that in an age appropriate manner.
Definitely.
Yeah.
Yeah.
And just like we've said, I mean, ultimately, I am very, very cautious in full faces where you use like 10 plus mils of filler, because ultimately, whilst it looks good on the day, what does that result look
Yeah.
like in 2 years'
Mhm.
time?
Yeah.
Filler is a gel like structure. It is very, very difficult to use a gel like structure to create significant definition in the superficial tissues.
Yeah.
It
Yeah.
just is, it's
And
not
I
what it was
think we've
built
all
for.
seen it. We've had patients that they've had numerous treatments from us. When we get to that point, we say,
No.
look, no more. Your next option is you need surgery. And then what happens is they disappear,
Yeah.
and then you see a picture of them on Instagram.
We've all been
Gone
there.
elsewhere.
And they're sitting and their cheeks are up to there and they've got these little slits and you're like, oh no.
I know. And some of these rumours, like I do remember after my first cheek filler course saying to patients, oh, I can lift your lower face with cheek filler. Like I totally can.
Yeah.
And now
I
I'll
know.
say, I can lift your face with cheek filler, but you're going to need to look like a space raider. Like, is that
what
is
you
that what we're
want.
going for? And, I've not done it yet, but... But I think aesthetics is still it's still such a young branch
Yeah, we're learning
of
all
medicine,
the time.
isn't
Yeah.
it? It's
And the
still so young.
technology is
Yeah.
changing at such a
Yeah.
fast pace as
Yeah,
well.
definitely.
The range of products that we've got
Yeah.
is vast.
I do think we need to be more supportive and accepting of change as it happens, because I think what I see and what frustrates me is, some new evidence will come out and all of a sudden somebody will appear on TikTok or Instagram and they will be the authority. And
I know.
I've always done this and yous are, your
You
practice
know
is
nothing.
wrong. Like, you know nothing. Like, I mean, this patient came to me and I knew that's what they'd had done. And I think we just need to be more accepting of the fact that things move on. And I say
Yeah,
to patients, like the way I filled
yeah.
your lips 10 years ago
Yeah.
is not the way I would fill
No,
your lips
no,
now. I have
no.
caused migration. I will put my hands up and say that. Like,
Yeah. No, and I've had patients that maybe, have been with me for years and years getting lip fillers, and then there does come a
Yeah,
point where you're like,
there
look,
does.
we're going to have to
Start
dissolve
again.
these and start again.
Absolutely,
And there's no
absolutely.
shame in
No,
saying that as
not
well,
at
you
all.
know.
And even so, I love doing noses as well. But ultimately, I will say to a patient, this will not last in your nose the
Yeah.
way that it looks today. In 5 or 10 years' time,
Mhm.
it will come a point where this will need to be dissolved
Yeah,
and redone. This is not
exactly.
a permanent
Yeah.
solution, and you need to have that
Yeah.
relationship with me that I can tell you.
Yeah.
We're
You
much
know.
better at having those conversations before we fill patients
Yeah.
with
Yeah,
HA
that's
filler
good.
than we used to
Yeah.
be. And I think they appreciate that transparency of
Yeah,
us saying, yes,
honesty.
I can give you
Yeah.
a good result right now, but this is what's likely to happen over
Yeah,
the course of time.
exactly. And then you've prepared them.
Absolutely.
this is
yeah.
it. And that should be part of your consent
Yeah.
process as well.
Yeah.
To make
Yeah.
sure they
Yeah.
understand that before
Yeah.
they decide to proceed with their treatment.
Absolutely.
And I think, like for me, my gurus are Costefana and Arthur Swift.
Yeah.
That's my two heroes.
We met
Love
Arthur
them.
We
recently.
did recently.
And I've just watched their practice throughout the years and how much even they've changed.
Yes. And he said that.
And
So he was
it's-
at MCAS and we had a couple of sessions with him recently. It was incredible. But he said the very same thing. He said, the way that I inject now is completely different. And he
Yeah.
said, I have stood up on a platform 5 years ago and given a lecture about, full face volumization
Yeah.
using X, Y, and Z. And he's like, and now I think differently. And I'm
Mhm.
not afraid to
Mhm.
stand up and say, look,
Get my
actually
hands
that wasn't
up.
right.
Yeah,
Exactly.
exactly.
And he was the very one that said, the measure of my success is not how my patient looks on the day, but how my patient looks when they come back and see me
Yeah.
in 2 years' time.
Yeah.
And I fully agree with that. And that's what we say to all of our patients when they come in. Ultimately, your before and afters are, it's nice, but we have such long-term relationships with our patients that we never want to do anything
No,
that, you know, when they
absolutely
do
not.
come back in a year's time, you're like, oh no, that
Yeah.
was the wrong thing for
Yeah.
you.
Yeah.
So yeah, I do. I love Arthur. Love Cottabana as well.
Definitely. Yeah.
He uses
So,
Reveness, by the way.
oh, does he?
He does.
Does he?
He does.
Mm.
Yeah, so that was a demonstration of Arthur's practice using Reveness, but the portfolio is very, very interesting, and it is a very, very nice filler. It's very forgiving, very smooth, and there's a lot of thought that he's put into it. So essentially, this company sort of came to him and said, like, here's what we've got. What would you do if you had a magic wand? And he essentially guided them to create this portfolio. So it is an incredible range of products.
That's interesting.
It is interesting,
Yeah.
and I do really, really enjoy using the products. There are some areas that I still use other fillers for, and for very specific indications, but it is.
I think that's important as well, isn't it? We need to have a toolbox.
Yeah.
Oh,
It's
100%.
not just about having one
Yeah.
product in the clinic that we use for every single patient.
Yeah.
It's important that we've got this range of products, and because what you might use in, you know, a 30-year-old is going to be very different to how you approach treatment of somebody
Definitely,
who's 20 or 30 years older. And, you know, mentioned earlier on, the range of products we've got is vast, but it allows us to really treat patients as an individual. You know, choose the right products for the right person, the right place.
And it's about just having the knowledge to be able to make those decisions.
Yeah.
Do you know, so
it is a medical treatment plan, and you have to treat it like that.
Yeah.
You know,
absolutely.
any other
Yeah.
medical treatment that you're going to be doing.
Absolutely. If I treat a
look at it the
nose
same
and I
way.
don't have ultrasound, I will use Restylane Lift. And I use Restylane Lift because it's a good high G prime filler, but because if you line all the regulated fillers up side by side and you look at what breaks down most effectively with Hyleas, Restylane Lift, despite its high G prime, is the most
That's a
easy
great
filler
tip.
to break down. So I would always reach for that over any other dermal filler.
Yeah.
For any high risk area, you know. So I think it's just about having that toolkit, and you can be the best artist in the world, but if you're using, you know, pound shop paint, like you're not going to create the Mona Lisa, are you?
And let's face it, I mean, you can buy fillers for £30 a box or two or what, or less than that, and unfortunately, because aesthetics has been demedicalized, I think, you know, that's the way it is. But hopefully today,
oh yeah, of course, it is
today
isn't
we
it?
will get more news, and
Absolutely.
hopefully we'll know which way it's going to go.
And there has
tighten everything
there
up.
has to be a change, you know. And but I think even with regulation though, filler companies, because it is a medical device and not a medicine, you know, they still market very cleverly to practitioners. And I know some medics that will be using dermal fillers and not realise that a CE certification doesn't mean anything.
No,
You know,
absolutely.
CE certification, generally when you look at the CE certifications that most of these dermal fillers have, it is a CE certification that's something that is okay to be applied to the skin, not injected in the skin.
Exactly.
You know, and I say this all the time, but my kids' toys are CE certified. It doesn't make them suitable for injecting in a human face. You know, so I do think a lot of practitioners just have this false sense of security when there's that CE certificate on the box. And I speak quite openly with practitioners about their choice of dermal fillers. So if you look at Revelax, we know that Revelax is very difficult to break down. And again, Revelax uses ursolic acid to do instead of the cross-linking technology, and ursolic acid is that waxy coating that you find on apples, and hyaluronidase does nothing for ursolic acid. So Revelax is very unpredictable when you try and break it down. There are some other fillers, even regulated fillers. So the fillers that use polymer technology need a third more hyalase. So I think you need to be really, really certain about the products you're using and how those products integrate in the skin and how those products will behave in the event of a complication, whether that is a vascular occlusion or a nodule.
Yeah.
And we see a lot of patients with unregulated filler in their face, and even dissolving with ultrasound guidance, the filler burden is so difficult to break down over time because these fillers just will not budge.
Yeah.
And you don't know what is
Mhm.
in them
Yeah.
that is making it so resistant. And imagine that was a vascular occlusion.
Yeah.
You know?
Absolutely.
So
Yeah.
I think my plea would be for practitioners to think about more than just how it looks in the before and after
Yeah.
pictures.
And the cost.
And the cost, yeah, just
And it is tempting for new practitioners to look at the
course
cost
it
and think,
is.
oh,
Of
do you
course
know,
it is.
that's a good markup I'm going to have in that. But,
Yeah.
do
Absolutely.
you know,
You
come
can't
on,
blame
take
them for
responsibility. And
yeah, absolutely. And what you don't know, you don't know. You think it's just
exactly.
it's hyaluronic acid. How much harm
Mm.
can it be?
Mhm.
And then all of a sudden they have a complication. And, these patients, I mean, when they develop nodules and they have all of this filler in their face, it can be catastrophic for them. It's worse than a vascular occlusion.
Yeah.
Yeah.
They have a filler in their face which is not breaking down with hyaluronic acid, or they need repeated treatments
Mm.
with hyaluronidase. And, it is terrible. It's a terrible process for the patient. They can often require multiple doses of steroids. Steroids have so many other complications as well.
100%.
And
Yeah.
something that was meant to make a patient feel better ultimately is, really starting to affect their health and their well-being.
And the
So
psychological impact of that,
Oh,
like you
it's
said,
huge.
someone has gone for a treatment looking to make their, improve their appearance, make themselves feel better. And that's the end result. And like you were saying, Paula, the management of that can be ongoing over weeks and
Yeah.
months
Yeah,
to get to an
definitely.
end point. That process is really tough on a patient physically and mentally. And
Yeah.
you touched on it earlier, Julia, saying, the shame that comes with that
Oh,
of,
Mhm.
was it vanity
I
that
did
made me
this.
seek
Yeah,
that treatment?
That's
And now
right.
look
Yeah.
what I've done to myself. And
Mhm.
absolutely.
that's quite a burden for someone who's
Definitely.
It's
Yeah.
possibly been a
horrific.
little
Yeah.
bit vulnerable in the first place
Mhm.
Horrific.
Yeah.
to carry.
And a lot
Yeah.
of these
Needs a lot of hand holding.
Yeah, oh, absolutely.
Mhm.
A lot of these filler companies are nowhere to be seen in the event of a
Yeah.
complication.
Yeah.
So I have got first-hand experience of complications involving premium reputable brands in the UK, and in every single occasion there was an expert at the end of the phone who
A
was
medical
like,
expert, a
Mhm.
I
scientist.
am
Right.
going to tell you what I know about this. I'm going to
Yeah.
give you advice, and we're going to work through this together.
Yeah.
I also have experience of unregulated fillers that are very widely used, where the head office is not even willing to share the list of ingredients that is in that filler, let alone put you in touch with a medical expert. So before you make that choice as a practitioner or as a patient, you really need to be super clear about what will happen, because as much as complications are rare, they do happen.
They
Of
do
course they
happen.
do.
And
Yeah.
there's some evidence that nodules is actually more of a genetic variant than it is to do with autoimmune conditions. So there's some evidence that there's actually a genetic variant which will make 1 in 10 of us predisposed to developing some sort of inflammatory reaction to dermal
Mhm.
filler. So it is a lot more common, or could be more common than you think.
Mm.
So you need to be aware of what you're putting in your patients and how that is going to, how it's going to work if you do have a complication, and not just a vascular occlusion.
Yeah. Yeah.
sure.
Definitely. Yeah.
I think there's this misconception that if you apply hyalase to dermal filler, it just dissolves. And if you think that, I would urge you to do an experiment in your clinic where you put a mill of filler, in a petri dish and you apply hyaluronidase to it, and if you leave it for 24 hours, I will guarantee you that
There's
there will
still
still be
some,
filler
yeah.
there at the end of the day.
Yeah,
And I see that in
definitely.
ultrasound.
Yeah.
That even with ultrasound
Yeah.
guided injections, the dermal filler gets less, but it
Mhm.
doesn't go away
We
completely.
actually do that in our complications course.
Yeah.
So we put, you know, well, whatever we've got
Yeah.
in little dollops on a tray,
Mhm.
and then we inject high concentration of
Yeah.
Hyleas into them. And then, you know, they're pressing it with their finger, and I'm like,
No, you don't.
it's getting
Yeah.
less, but it's
It's
not
still
going to
there.
go to water.
Yeah.
And you have to understand
Mhm.
that.
Yeah.
And that's what
Yeah.
happens when you're injecting into the
Absolutely.
skin.
Absolutely.
It's
And it's, you know, and that's with fillers that respond predictably.
exactly.
Yeah, there's
Yeah.
so many out there that
Yeah.
don't respond predictably.
No.
So yeah, I would say, like, if there was one thing that I had control over, it would be that you know, we had a more open approach to the science of dermal fillers and
Yeah.
a lot more discussion about not only how it integrates, but how it behaves when the immune system reacts when you're pregnant,
Yeah.
you know, when your hormones change,
Mhm.
like when you lose weight,
Mhm.
all of these things.
Even
I think are
something
so
as
helpful.
simple as going through the menopause
Absolutely.
can totally change your
Mhm.
fillers.
Absolutely.
Definitely. Yeah.
Absolutely.
Yeah,
Yeah.
definitely. Well, ladies, that was really interesting, and
Enjoyed that
it
discussion.
was. It was a
Mm.
great, and hopefully other people have got something out of
Mhm.
that. And, you know, if you've got any questions, put them in the little comments below. But in the meantime, please subscribe to our podcast, and I'm sure we'll have you back again. If anybody's got any other suggestions of what you'd like to hear us chatting about, then please pop it in the comments.
Absolutely.
Thanks
Thank
for
you so
having
much for
us.
having
Thank
us. It's been a
you.
pleasure.
Thanks.
Thank
Been
you.
great.